what are the obesity numbers and how have they changed over time?
So in the early 1960s, less than 15% of adults were obese.
Mm-hmm.
But by 2014, 2015, 37% of adults are obese. For children, we have data going back to late 60s, early 70s. About 5% of children, 2 to 19, were obese, and today that's up to over 17%. So a doubling for adults, a tripling for children over that time period.
And in the last few years, have things accelerated, or has there been any signal they're leveling off?
So for our very youngest children, we are seeing an actual decline in obesity rates, very small, a leveling off. And for adults, we're seeing a continued increase.
Okay. And is this just a U.S. problem? Or is this a global problem, a developed country problem?
So obesity is a global problem, and it is a problem for all countries, regardless of the level of development, the level of income. What we're seeing in low-income countries is as they make this transition to higher incomes, they are adopting the behaviors that we see in the higher income countries, and they are having the same kinds of rates of obesity and then non-communicable diseases, heart disease, diabetes, and so on, that we have in the higher income countries.
And what are the fattest countries? It's us and who else, and how far ahead are we from the rest of the world?
So in terms of the competition, the U.S. and Mexico vie for first place in terms of the fattest country in the world. Certainly the developed countries, the high-income countries have had a head start, but many countries are catching up.
Okay. Let's talk a little bit about why that is. You mentioned that a colleague had said that all inventions since the wheel are labor-saving devices. I mean, what does that mean, and what does an electric can opener have to do with this obesity crisis?
So the obesity crisis is driven by an imbalance between the amount of calories we take in, the amount of food that we're eating, and the amount of calories we put out, the amount of physical activity or exercise that we do. And over time, our calorie consumption has increased quite dramatically, and our physical activity has decreased, but more modestly. So the obesity crisis is really driven by an increase in calorie consumption, and it's a decrease in consumption that's going to turn the crisis around. But how do we do that? So what's changed in our society over the past 30 or 40 years that created this problem? We have many more foods available to us than we did in the past. We have many more high-calorie, low-nutrition, and cheap foods available to us. Things like sugary drinks, things like snack foods that are much more readily available and we can consume easily. These are all driving the increase in consumption. Packaged, prepared, and restaurant foods. We're not cooking our own meals. We're often not eating together as a family. These are all changes that are associated with increased calorie consumption.
Okay, and also tell me a little bit about soda. You talked about the numbers of sodas consumed and the size of those a few decades ago compared with today. What are those numbers?
Yeah, so soda is not the cause of the obesity crisis, but it's certainly a contributor to the obesity crisis. And we note several changes related to sugary drink consumption. One is that in the 50s and 60s, the average size of a serving of soda was 6.5 ounces. And today the average size is 20 ounces. So that's 250 calories compared to about 80 calories, a huge difference. Most recently, soda consumption has actually come down in the U.S., but through the 80s and 90s and into the 2000s, soda consumption was increasing, And we went from late 1980s, about 350 12-ounce cans of soda per person, up to about 425 12-ounce cans per person in the early 2000s. We know from research that adding one 12-ounce can of soda to the diet increases the risk of obesity by 60%.
Wow. And finally, you're all about public health policy, and one of the initiatives out there is to increase access to healthy food, increased farmers markets and things like that. Are those widespread enough to have an impact yet, or are they still too new and too small?
So I think things like farmers markets, things like working with bodegas and corner stores and convenience stores to increase offerings of healthful foods is a strategy that can change the kinds of foods people purchase, can improve the quality of the diet, and we'd like to see that grow. But at this point, they're not wide-reaching enough, not reaching the size of the population needed to make a huge contribution to solving the obesity problem.
Thank you very much.
Thank you.